السلام عليكم السادة الحضور. نرحب بكم في ورشة العمل الإلكترونية التي تنظمها وحدة التعليم المستمر في كلية الصيدلة جامعة بغداد، واللي نستضيف من خلالها الدكتور ماثيو سميث من جامعة كاردف في بريطانيا. Welcome and good evening. Welcome to this workshop organized by the Continuing Education Unit at the University of Baghdad College of Pharmacy. It's our pleasure today to invite Dr. Mathiew Smith from Cardiff University. Dr. Smith is an experienced senior lecturer with a demonstrated history of working in higher education industry, skilled in drug delivery research, biotechnology, chemistry, and drug discovery, strong education professional, graduated from Cardiff University. He is currently the Director of Learning and Teaching, Chair of Undergraduate Board of Studies, Chair of Program Management Group, member of OSCE Steering Group, member of Board of Studies and Board of Examiners of the MPharm program. Dr. Smith will talk to us today about the changing landscape of initial education and training of pharmacists in the UK. Thank you for accepting the invitation, Dr. Smith. Welcome, and please go ahead.
Thank you very much for the warm welcome. It's absolutely my pleasure to come and speak to you today. As you probably know from one of your audience members, I've got quite a great affinity for the education and training and research that takes place in Iraq, and Fadia, who I worked with for quite some time now through her PhD studies, was really instrumental in changing some of the policies in Wales around care homes and the use of medicines. But what I really wanted to talk to you today about was how the initial education and training of pharmacists is changing in the UK. And I'll probably focus a little bit on Wales, because I'm in Cardiff and we're in Wales, and the health policies in the UK are devolved to the individual nations, to Scotland, to England, Wales and Northern Ireland. So I'll focus on Wales today and try to talk a little bit about where things are similar across the UK and where they're perhaps particularly special in Wales. So just so that everybody knows where I am, Wales is this little small bit on the left-hand side of England, and we're right at the bottom of Wales in South Wales, and we're quite close to sort of Bristol and London. It's about a 2-hour train journey to London from Cardiff, and I know that probably in most countries the national sport is football, but in Wales it's rugby. And I did have a quick Google yesterday to see whether there were any rugby teams in Iraq, and I could see that actually Iraq does have a rugby team, and it's growing in popularity. So that was really good for me. So I thought I'd start with just telling you a little bit about how pharmacy is regulated in the UK. We have a national regulator called the General Pharmaceutical Council, or GPHC for short. And the GPHC are involved in a number of things. They hold a register for pharmacists, pharmacy technicians, and pharmacies in Great Britain. So anybody can go to the GPHC website and they can identify whether a pharmacist is registered, whether a pharmacy itself is registered. And they're really involved in making sure that the standards of care for people who are using pharmacy services are of a good quality. So they're very much about protecting the public and giving them assurance that they will get safe and effective care. But one of the things that they also do is that they set the standards for the education and training of pharmacists in the UK. So at the moment, there are 30 schools of pharmacy in the UK. All of those are regulated by the General Pharmaceutical Council, and they set out a series of standards and learning outcomes that students must, and universities and schools of pharmacies must address in order that a student can register as a pharmacist. So the way that pharmacists are trained in the UK is changing, and I'll talk about that a little bit later. But currently, to become a pharmacist, a student would undertake, from 18 years of age, a 4-year Master of Pharmacy degree in a university in one of these 30 schools of pharmacies. And once they had completed that 4-year Master of Pharmacy degree, and there is no bachelor's, I should say, this is a 4-year integrated master's program in all schools of pharmacy. Once they've undertaken that at university, they would then undertake a 1-year program of training, generally in a community pharmacy or in a hospital pharmacy. And at the end of that 1-year training program, they would sit a national registration assessment, a licensing exam, and they would undertake health and character and identity checks. And as long as they have been signed off by their supervisor in the community or hospital pharmacy, they've successfully passed the national licensing exam and they're of good character, they would then register as a pharmacist. And typically in the UK, there has been really 2 places where a pharmacist then would work, either in community pharmacy or in a hospital pharmacy. Some years ago, the regulations and the law changed in the UK to allow pharmacists to become independent prescribers. So as well as dispensing medicines and supporting patients with their medicines, they were able to prescribe medicines. And to do that, once a pharmacist had registered with the General Pharmaceutical Council after 5 years, they would then have a period of 2 years where they would have to undertake further experience as a pharmacist before they completed an independent prescribing program. And that was 1 year long, and then they could register as an independent prescriber. So in total, from starting their master's program through to registering as a pharmacist and then as an independent prescriber would have taken 8 years. And I'll return to that a little bit later to explain how that is becoming much shorter time frame. So what does that look like in Cardiff? Well, just to tell you a little bit about the School of Pharmacy here in Cardiff. We have one undergraduate program, the Master of Pharmacy, and then we have a number of postgraduate taught programs. So for pharmacists who have graduated and registered and who want to continue developing their clinical pharmacy skills, they can undertake a clinical pharmacy diploma or master's. We deliver the independent pharmacist prescribing course as well. So that's for those individuals who've had 2 years of experience. They do a year-long program to register as a prescriber. And then we have a master's in clinical research for individuals who are involved in the clinical trials industry to professionally develop. And we have a cancer biology and therapeutic master's program as well. And then we also undertake quite a bit of postgraduate research, particularly with PhD students. And recently we've introduced a lot of CPD courses for pharmacists. So whether that's those who want to develop some research skills, for those who want to develop some clinical assessment skills of patients, those types of courses, short modules where an individual wouldn't have to sign up for a program but could undertake a short period of studies to improve their skills. And the MPharm program itself, we train about 130 students every year. And as I said, it's our only undergraduate program. And the entry requirements, and this is the A-level entry requirements, are quite high, but in line with other healthcare programs in the UK. So typically a student would need to have 2 A's and a B, or an A and 2 B's at A level. And we have in the school about 45 teachers across, as I'm sure your school is exactly the same, across a range of different disciplines, from medicinal chemistry, pharmacology, therapeutics, pharmaceutics, clinical practice, the whole range really. And we are housed, the school, we have our own school building. So unlike some UK universities where a building is shared by a number of different programs, we have our own building here in Cardiff called the Redwood Building, and all of our teaching, except for our placements, takes place within the school. So we're really lucky to have a very community feel in the school. And I hope this is going to work, because in 2019 we were 100 years old as a school delivering a pharmacy program, and we had a centenary event where we all dressed up and taught the students as if they had joined the pharmacy program in 1919, and the BBC News came along and filmed a short video of that. So I'm going to stop sharing my slides and just hope that this video will play, because it's a nice reminder of where pharmacy training and education was in 1919. I hope this will play.
Punctilious preparation and scrupulous presentation are the order of the day.
What else is happening in 1990? I'm Bryony Hudson, and I'm the historian for the School of Pharmacy and Pharmaceutical Sciences. There are as many continuities as there are changes. The hands-on skills, the professionalism, the attention to detail, the thinking about the patient, and then the science behind the medicines. None of that has actually changed its core values. Considering the technology isn't as advanced, so you have to be more correct in your procedures to begin with.
I mean, the techniques we use are the same, it's more about the equipment that's different.
In the real world, we're going to have to decide what we do, so learning from the basics is the way to go.
Gives you a newfound grasp for, technology these days.
So I think that's a good example of where pharmacy has come from, very much based on natural products, on making powders, leaf drawings. So that, I guess, is where we were perhaps 100 years ago. So I talked a little bit earlier on about the standards that the General Pharmaceutical Council provide to schools of pharmacy. And our current pharmacy programme was designed against the set of standards that the General Pharmaceutical Council released in 2011. And these standards really focused, I think, on two areas. The first area that they concentrated on was ensuring that pharmacy programs in the UK were integrated. And what they meant by integrated was, historically in the UK, pharmacy programs were split into 4 different disciplines. So pharmacology, pharmaceutics, clinical practice, and medicinal chemistry. And the General Pharmaceutical Council wanted programs to be more integrated so that students could understand how the design of a new drug molecule, the chemistry of that molecule, how that impacted on the way that we would turn that into a medicine. And then when that medicine was taken by a patient, what happens to it in the body and what are the clinical elements of practice that surround that. And they felt that putting these different disciplines in separate parts of MPharm programs meant that students didn't find it that easy for to make the bridges between medicinal chemistry, pharmaceutics, pharmacology, and clinical practice. They kept these separate disciplines in separate boxes. So sort of before those standards came out, this is what our program looked like. So they're in blocks of each of the years of the program. So anything that starts PH1 is a first year module, PH2 second, PH3 third year, and PH4 fourth year. And so you can see here, I think we've got, you know, something like 17, 18, 19 modules. Those modules were in very specific areas of the curriculum, and they were very discipline centered. And other schools of pharmacy would look like this as well. So very small modules, lots of assessment. I think we counted the number of assessments we had on our pharmacy program, and we had 101 assessments because all of these modules would have at least one assessment associated with it. And it was hard for students to see how the program linked together to help make them an expert pharmaceutical scientist and an expert pharmacist. So we really revised that module structure because of the need for integration. Around each year had a theme to it. So our first year was about self-care. So about patients who were generally well, but perhaps might have a condition where they would come into a community pharmacy in the UK and they would need some advice. So that started with a module called Molecule to Patient. And Molecule to Patient takes really a student on the journey of all of the ways a pharmacist can help and shape drug development, be involved in clinical trials, designing new drugs, and then how they are used in patients. So it's an introductory module to explain to students all of the parts of going from a drug that's a new molecule in a laboratory through to it being developed and administered to a patient. We would introduce to students the role of the pharmacist in professional practice. What does a pharmacist do? We had a module that's about the structure and function of cells and microbes, so they understand microbiology and they understand the self-limiting infections that we get as humans. Human body systems, where we explain to them about biology and pathology. And then what is it about a molecule that makes it a good drug in chemical and biological properties of drug molecules? And in all of these modules, the examples that we give are based on medicines that can be used and that are generally found in a community pharmacy for self-care for patients. In our second year, the theme is of providing pharmaceutical care, and it's providing pharmaceutical care to priority clinical areas. So things like heart disease, high blood pressure, diabetes. They're sort of really common diseases that we have in the UK and put such pressure on the health system and on patients. And using those areas as an example, we show students how we design drugs in those areas, how we turn those molecules into medicines in formulation science, how the clinical aspects of using those medicines, patient assessment skills, patient monitoring, patient education. And then finally, how when a patient takes one of those medicines, what happens to it in the body? What's its disposition in the body? Our third year is very similar, except now it is really featuring complex patient diseases. So this, in the third year, we particularly focus on pain management, psychiatric disorders, dementia, Alzheimer's, movement disorders, cancer. And again, it's about how do we design drugs in those areas? How do we manufacture them? How do we use them in an optimal way in patients, particularly where a patient will not just have cancer, but they will also have high blood pressure and heart failure, and perhaps dementia as well. And we also introduce students to research as well, and particularly how they can undertake research in preparation for the fourth year of the programme. And the fourth year of the programme features a master's project, but then it also deals with the pharmaceutical sciences, pharmacy and the population. And here we tend to be talking to students about population level problems rather than the individual patient. And then a complementary module that is very much about pharmaceutical sciences, pharmacy and the patient. So dealing with patients who have very complex disease states and medicines regimens. So hopefully what you can see from those series of slides is that those new standards that came in 2011 changed pharmacy education in the UK from a very discipline-based approach with very little integration between modules and ideas and themes, to programs where the schools of pharmacy, the pharmacy programs make those links or help students to make those links by a more integrated structure. And the other thing that those changes focused on as well was moving students in the pharmacy program from just knowledge-based and practice case studies to actually getting them to do things and to test their competency in clinical areas. And this was really about two things. The first of those was introducing and expanding placements. And in the MPharm program, it was very much, I don't know if you've come across Miller's Triangle, but pharmacy programs in the UK are designed around Miller's Triangle. First, perhaps ensuring students know about a topic area, then knowing about how they can apply that topic area to clinical and pharmaceutical science problems, then demonstrating how that they would apply those through sort of simulated practice, through OSCEs, observed pace assessments, simulated patient assessments. And then finally, where they are given the responsibility to independently do that activity. So I guess a good example here would be if we were training students to undertake vaccinations. First, we would explain to them what a vaccine is, the science behind it, why it's important to vaccinate people. Then we would then start to explain to them and show them how you would give somebody a vaccine, the challenges of doing that, taking consent from people. Then we would get them to demonstrate to us that they could do that themselves using, instead of on a real patient, that would be we would use a simulated arm where they would demonstrate to us that they could safely vaccinate that simulated arm before finally they would be initially supervised, but then independently carrying out that vaccination on patients. Now, for most of the outcomes and the learning outcomes in those standards from the GPHC in 2011, in the pharmacy program, the aim was to get students to the shows how level. So demonstrating to us they could give a vaccine, demonstrating to us that they can do a very high quality consultation with an actor, carrying out a dispensing test, but not actually giving the medicines to a patient, okay? And then the pre-registration year, that 5th year, when they're out in practice, would be at the DOS level. They would then actually be dispensing and giving vaccinations. And just keep that in your mind, that in these 2011 standards, our job in schools of pharmacy was to get students to demonstrate at the shows how level, because I'll return to that in a little bit. And one of the ways that we were tasked by the General Pharmaceutical Council to start getting students more involved in clinical activities was for them to undertake more placements. So this is a little bit of a busy slide, but it explains to you probably what our typical placement experience is for students in a pharmacy program in the UK, and lots of schools will be quite similar to this. So generally in the first year, it's about getting students to understand what pharmacy is like in the UK, and particularly community pharmacy. So students spending a half day in a community pharmacy in groups to understand the role of community pharmacy. And then we in the school would place them for 8 half days in a local hospital, not with the pharmacy team, but with, in the UK, we have a volunteering service. And the volunteering service, they go onto the wards in the hospitals, and they spend time perhaps with patients who don't have any families, who are lonely. So they call that a befriending service. They help carers and families to find their way around the hospitals. They undertake patient surveys, questionnaires to understand how satisfied patients are. So we would send students for 8 half days to the hospital to take part in those activities so they could understand what it is like to be a patient in a hospital. In the second year, they would spend a week in a community pharmacy on their own with the pharmacy team, plus 2 days in a GP practice. In the third year, a week in a hospital pharmacy, and they would then select up to 2 days in a placement where pharmacists haven't traditionally worked, but are starting to work in the UK. So this could be in a nursing home. This could be working with a community mental health team, a range of different or working with domiciliary care workers, so people who provide care to people in their own homes, a range of places where pharmacists are starting to work. And then finally, in the fourth year, they would have a short series of placements just in specialist areas, or going out to measure blood pressure, weight, and provide lifestyle and health advice to patients. So in total, it's about 25 days of placement experience in a UK pharmacy program. And I guess if you were to compare that to a medical school or to a school of nursing or dentistry, that's, pharmacy schools don't have a huge amount of placement-based learning currently. And the other area that the General Pharmaceutical Council asked schools to concentrate on was interprofessional education. So students, pharmacy students, learning with other students in other healthcare disciplines. And we in the school are very lucky. We're very lucky in Cardiff, actually, that Cardiff University has all of the disciplines, the healthcare education disciplines. So we have a school of medicine, dentistry, optometry, nursing, physiotherapy, occupational therapy. We have the whole range. So we're very lucky in that way. And we have 8 sessions in the 4 years of our program. The first unit is in the blue here, and that is about clinical skills that we know that pharmacists and medical students will undertake in their professional careers. So basic life support, cardiopulmonary resuscitation, using defibrillators. We run a mock respiratory clinic. So really this is an asthma clinic. How do you measure somebody's airways? How do you train them to use an inhaler properly? In the third year, safe injecting. And in the fourth year, on a ward, how would we monitor vital parameters of a patient to make sure that they are not deteriorating, and if they are deteriorating, what we would do about that. In the green stream, it's about understanding particular types of patients. So working with our optometry colleagues, understanding eye conditions, working with dental students and colleagues in the dental school, oral health. In the third year, working with medical students to understand how GP practices work in the UK and look after patients. And then finally, in the fourth year, patients that are terminally ill, perhaps with cancer, how you manage those patients and how you prescribe for those patients. And then we have this final red stream, and that red stream is about prescribing and therapeutics, and particularly looking at the harm that can result from medicines if they are not used and prescribed properly by individuals. So that is where we were, but there's been a number of changes across the UK that's really quite radically changed the direction that we are going in. Now, I'll focus a little bit on Wales here. So in 2018, the Welsh Government developed a plan called A Healthier Wales. And this plan was a national plan to ensure that everybody who lived in Wales had a longer life and a happier life, and were able to remain active and independent in their own homes for as long as possible. So people staying in their own homes rather than having to go into a hospital or into a care home. And what this meant was there was a real drive to move healthcare workers to support patients in their own home rather than waiting for them to come into a hospital when they are ill. So more services and more resources that are based in the community. And this was a national plan for all healthcare and social care workers. But then each of the representative bodies then developed their own plan that met the goals and objectives of A Healthier Wales. So pharmacy developed a plan called Pharmacy Delivering a Healthier Wales. And there are some key elements in that about how the government saw pharmacy changing in Wales in the next 5 to 10 years. So that focused on a few things really. So the one was making sure that the outcomes from patients using their medicines were improved, so that patients weren't coming to harm from their medicines, and so the government got good value from the medicines that were being prescribed to patients. So this plan was developed in 2018, and it's actually a 12-year plan until 2030. And what a big part of that plan was about, we have 3 separate areas really where people receive pharmacy care in Wales and in the UK. In community pharmacies, which are sometimes called retail pharmacies or business pharmacies, pharmacies in hospitals, and then pharmacists working in GP practices. And what happens in the UK is that those different pharmacy teams are not very well integrated. So a patient might go and see a community pharmacist, then they're admitted to hospital, but nobody tells the community pharmacist that's looking after them that they're in hospital. So the care is not very joined up. So one of the big changes from these standards is looking at making sure that that care across community pharmacy, pharmacists working in primary care, and pharmacists working in hospital is more joined up, and also ensuring that there's a shift that more of their care, of a patient's pharmaceutical care, can be undertaken in community and primary care rather than them going to hospital. I always ask my students on the first day of term, what do they think the most expensive hotel in Cardiff is? And they talk about the Hilton Hotel. And I tell them that the most expensive hotel is the Heath Hospital, because a stay in a UK hospital overnight without any treatment costs the UK government about 2,000 British pounds. So that's before they've had any treatment. So hospital care is very expensive in the UK. And all of our care is public health care. We don't have an established private health service for the vast majority of our population. So there's a real drive because patients want to stay in their own homes and in the community, but also because it's expensive for them to be in hospital. And the Pharmacy Delivering a Healthier Wales policy talks about a number of areas that need to change, a number of goals. So some of those I've talked about: care delivered in local communities, improving patient knowledge and use of their medicines, making sure that pharmacy technicians can take on some of the roles that a pharmacist has traditionally undertaken to free up a pharmacist's time to spend more of that time interacting and supporting patients, and creating new and innovative services and using technologies. But one of the really important changes and goals for pharmacy education was this outcome about pharmacists using tools that include prescribing. So a real drive to make more pharmacists independent prescribers. And they specifically in this document talked about how we would develop the pharmacy workforce. So part of that was about creating high quality training sites in Wales for both placements in pharmacy programs, but also for that pre-registration year, that 5th year where students are working towards registering as a pharmacist. Okay. Pathways of development for pharmacists and pharmacy technicians. And what they also talked about was that schools of pharmacy, undergraduate programs were an important piece of this in creating the foundation skills and knowledge for prescribing, and a really ambitious goal that says by 2030, all pharmacists who have roles with patients, so not academic roles or research roles, but roles where they actually work with patients, that by 2030, all of those pharmacists would be prescribers, and not just that they would have the qualification, but that they would be actively prescribing for patients. So this is quite a big change for pharmacy, really going from a role that historically was about dispensing medicines and educating patients on their medicines, to really taking a significant role in diagnosing patients, testing patients, undertaking clinical skills with patients, and then prescribing medicines for them, something that's historically in the UK just been something that doctors would do. So whilst I presented to you Wales's policy on this, similar policies were also introduced for pharmacy and healthcare more generally in Scotland and in England and in Northern Ireland. And the General Pharmaceutical Council responded to that by publishing a new set of standards. So these are 10 years after those 2011 standards that I talked about a little earlier. So the GPHC recognised that there was a shift in Great Britain towards more care being at home, services moving from hospitals into the community. They recognised that people were living longer and therefore have more conditions and more long-term conditions that have to be managed. And that was an area where pharmacists in the UK could be particularly involved. And really thinking about a shift from how do we keep people healthy rather than when they are ill, how do we resolve that illness? So those new standards have introduced a number of things. So again, building on that interprofessional education, more emphasis on pharmacists and pharmacy students working with other healthcare professionals. So integrated multi-professional teams, okay? Ensuring that all pharmacists are providing really high quality care and interactions and consultations with patients. And then finally ensuring that pharmacy undergraduate programs laid the foundation for students to graduate and register, not just as a pharmacist, but as a prescriber as well. So the two elements of that I'll just briefly pick up on is, I think, one, how schools of pharmacies were tasked or are being tasked with incorporating the skills, the knowledge and attributes for prescribing. And that was to enable, or is to enable, pharmacists to prescribe at the point of registration rather than waiting for more training opportunities afterwards. And also to do that, making sure that that 5th year of education, the pre-registration training year, had increased support for students, more opportunities for them to undertake collaborative working and to make decisions and to follow up those decisions with patients, okay? So remember I showed you this earlier, and I said to you that in the 2011 standards, the majority of the outcomes, there were 58 outcomes, learning outcomes. The majority of those were shows how at the end of the M-Pharm, the Master of Pharmacy programme, and the does was during the registration year. That's changed quite significantly, and I haven't put all of the learning outcomes here that are at the does level. But there's an expectation now that lots of the learning outcomes that were shows how in the 2011 standards are now tested at the does level in the pharmacy degree programme. So just picking one of them, taking responsibility for all aspects of pharmacy services and make sure that the care and services provided are safe and accurate. So before that was at the shows how level, whereas now that is at the does level. So students have to go out on placements, they have to provide care and services to patients, and they have to make sure they're safe and accurate. So activities that were in the pre-registration year, that 5th year after they had graduated, lots of those activities are now moving into the pharmacy degree programme itself. And the timescale for this, you'll see these have just been introduced. There's a very fast turnaround for us as schools of pharmacy to develop these programmes to meet the new standards. And basically any student now graduating from a school of pharmacy in 2025 has to meet these new standards. So we are working with our government organisation in Wales for extra funding so that students can undertake significantly more clinical placements in hospital, in community pharmacies and in GP practices, so that they can address these new standards at the DOS level. And that government organisation that we work with is an organisation called HEIW, Health Education and Improvement Wales. And they have started the work on that pre-registration year. So in Wales now, whereas in the past, a student would either do their pre-registration year in hospital, or they would do that pre-registration year in a community pharmacy, they will now spend an equal amount of time in a hospital, 4 months, an equal amount of time in a GP practice, another 4 months, and then another 4 months in a community pharmacy as well, so that they understand all of the different sectors of practice. So for example, in their hospital rotation for their pre-registration year, drug history taken, optimizing medicines, clinical governance, those types of activities will be have been introduced. In the community pharmacy, responding to symptoms that a patient comes into the pharmacy with, responding to requests for medicines, counselling patients, helping them to stop smoking, dietary, nutrition services. These are enhanced services. And then in the GP practice or primary care placement, reviewing patients' medications, ensuring medicines that they've been discharged from hospital on are then similarly prescribed in the GP practice, managing chronic diseases, visiting individuals' homes. So spending time in each of these different sectors to understand the role of the pharmacist in that sector. Plus then, and this is a real enhancement in Wales, not just then spending time in those different sectors, but having an educational programme built onto that pre-registration or foundation year, so that they have face-to-face teaching, 12 to 14 days teaching, prescribing safety assessments so that they understand how medicines are prescribed safely, and sessions with experts in particular areas of expertise in the UK where they cannot get access to those types of individuals on their placements. So perhaps to just quickly summarize that, if you recall, right at the start of this talk, I explained how you, as a pharmacist, how you become a pharmacist, register as a pharmacist in the UK, and then undertake your independent prescribing qualification and register as an independent prescriber. And at a minimum, that would take 8 years. The changes to enhance the use of pharmacists and make them more able on day one of registration are compressing that 8 years to 5 years. So students will still undertake a 4-year pharmacy degree programme. They will undertake 52 weeks of registration training, but now it's not a community pharmacy or a hospital pharmacy. It's 4 months in each of community, hospital, and a GP practice. The 4-year pharmacy programme will lay the foundations for prescribing, and in the pre-registration year, they will then practice prescribing. They'll complete the registration national licensing exam, and then they will register as a pharmacist and an independent prescriber at the end of 5 years. So a real big change, a minimum of 8 years now down to 5 years, and individuals coming out as prescribers and producing or implementing the services to allow them to prescribe immediately on registration. So I started with a video, and I'll finish with a video. We as a school produced a video of how pharmacy is changing and what a pharmacist will look like in the UK, and I will share that with you now to finish.
This is Ellen and Aidan. They are pharmacists, which makes them experts in the science and use of medicines and the drugs inside them. They know which medicines work best to treat different illnesses, what the side effects can be, how our bodies interact with different medicines, and how those medicines interact with each other within our bodies. Pharmacists like Ellen and Aidan can work in lots of different settings. You probably know them best working directly with patients when they are unwell or need advice on their medicines, in doctor's surgeries, in hospitals, and in pharmacies in our communities. Pharmacists can offer advice to patients and other healthcare professionals, dispense and administer medicines and vaccinations. Many pharmacists prescribe medicines too, just like a doctor. But there are other ways in which pharmacists can use their expert knowledge to help patients in need. Some pharmacists work in laboratories where they carry out research to discover new drugs and treatments for all kinds of diseases. Others redevelop existing drugs to better treat the disease. Some pharmacists choose to research and test new ways of delivering drugs into our bodies, using technologies such as tiny needles, aerosols, capsules, or even nanoparticles, so that they work more effectively for all kinds of patients with complicated health problems. Pharmacists can also work for the companies that manufacture and distribute a whole range of medicines, or in government, helping to advise on medicines approvals. So, whether they design or develop a drug in a lab or prescribe medicines to make you feel better when you're ill, the one thing all pharmacists have in common is that they use their expert knowledge of medicines and health to improve patients' lives.
So hopefully that's given you a flavour of how pharmacy is changing in the UK. It's becoming very much more clinical and patient facing, and it's challenging schools of pharmacies to really push students so that on day one they have an increased knowledge and skill set. I'm very happy to take any questions anybody might have.
Thank you, Dr. Smith. This is really a very good overview of pharmacy education in UK, and I guess in Wales more specifically. And we do have questions.